Well, the number of daily new infections of COVID-19 has been quite high since the weekend after initially taping off. Malan is the editor of the Bhekisisa Centre for Health Journalism. She joins us now to talk about this. Mia, good afternoon to you. There have been huge conversations around the possibility of a second wave of COVID-19. Do we need to brace for something?
Well, that depends on who you listen to. I think most experts agree that we'll see a second wave at some stage, but they disagree on when that will happen and what a second wave will look like. So some experts argue that we're likely to see a second wave after the December holidays because people would have traveled a lot and there would have been many social gatherings during which the likelihood of complacency with things like social distancing and mask wearing would have been high. But there are also experts who say that a second wave could happen before December if we go by what happened in European countries. So we've seen second surges in about half of those countries, and on average, a second surge took about 55 days to emerge after the cases of the first wave started to stabilize. And in South Africa, cases started to stabilize around about September. So 55 days from that would be sometime in November. But it's worth noting that in almost all countries with second waves, three things happened. The countries started to allow relatively large gatherings, such as religious events or the opening of nightclubs again. They relaxed domestic and international travel restrictions significantly, and people became complacent with mask wearing and social distancing. And if we look at South Africa, larger social gatherings are now allowed, although nightclubs are still closed, and travel restrictions have also been relaxed, and we've seen reports of people becoming complacent. So some of the that could spur a second wave are certainly in place.
What is the likelihood of a second wave? And I mean, the countries that you refer to have also gone into winter, which means people spend more time indoors. The scientists tell us that outdoors is often safer. It slows down the rate of transmission. Is it possible to know what the likelihood of a second wave is?
I couldn't hear that question, Stephen, unfortunately. I assume that you asked perhaps what would a second wave look like, and I can respond to that. The question, of course, would it be worse than a first wave or would it be less severe? And where in the country would a second wave start? So some experts argue that a second wave would follow the same geographical pattern as a first wave. So it would start off in the Western Cape. And the Western Cape government has already expressed concerns about people becoming complacent with social distancing measures. But a second wave could very well happen in clusters. So hotspot outbreaks in different parts of the country that then spread, as we've seen, for instance, in the second wave of South Korea recently. So would a second wave be less severe than a first one? We really don't know, but many experts say that depends on that the answer lies in the levels of immunity that South Africans have developed and whether those levels of immunity are better or worse than in European countries. We've seen in a country like Spain that had a really, really bad first wave that the peak of the second wave, that the number of infections were even higher than in the first wave. But all in all, the impact of the second wave was less severe because the second wave tended to affect young people. And far more young people than in the first wave. And we know that young people are far less likely to develop very severe forms of COVID. So how bad a second wave will be doesn't just depend on how many infections there will be, but also on what parts of the population will get infected.
Mia Malan, thanks very much indeed, editor of the Bhekisisa Centre for Health Journalism.